And in the 1 ml facelift, the idea is to try to get the maximum benefit for the patient from the smallest amount of filler. So that means half a mil for one side and half a mil for the other. And so it's important to choose the key places. It's not always the same in every patient. And very often the most important place is here. Here there is often a shadow. And if there's a shadow here, there's usually a shadow that runs down here as well. The second place I like to go is in the eyebrow. And if we can raise the eyebrow by 1 millimeter, then we can increase the light that gets into the orbit. The third most important place in most faces is that there tends to be a little bit of downturning of the angle of the mouth, and so we want to try to correct that. And then if there's anything left over, it's usually helpful just to put a little bit here, which I tend to do subdermally with a fanning technique, and then that will cause increased volume, which will give anterior projection, which then lifts the face and even lifts the jowl down here a little bit. So with half a mil each side, that's 1 ml in total, we can get quite an important improvement, and we can repeat that twice a year. Well, of course, sometimes people need more than 1 ml, and sometimes I might do 2 or possibly 3 mLs in some patients. Well, undoubtedly, the one that we all fear most is blindness. So prevention, we need to be very careful to use cannulas rather than needles when we can, and we should use low pressure, we should aspirate before we inject anything. We should try to have the tip moving. In case we are in a vessel, we won't be in it for very long if we're moving. Probably inject in retrograde rather than anterograde, but there are exceptions to all these rules. But these are general rules that will help to minimize risk. We have to be particularly careful in some areas of the face where the blood supply is particularly rich. And so we must be constantly aware of this possibility, and we must prepare just in case the worst happens.